Our PECTUS patient, Nihat Göl, he is 55 years old man and he had PECTUS excavatum deep and Grand Canyon type. We have done modified Nuss operation successfully and he is okay. And now we will listen to him PECTUS story.
Hi, I'm going to talk about an operation that I've been meaning to have since 1984. Back then I was 17 years old and I was diagnosed with PECTUS excavatum cavity and suggested that I should undergo the operation, open thoracic surgery, which is also called modified Ravage operation, which is back in the day, it was an extremely painful operation with a very little success rate, and I did not have any medical symptoms that justified the operation. I used to play basketball and it did not intervene with my performance, so I decided that I should wait until I develop some sort of medical symptoms that will make the operation necessary. So I waited until my mid-40s, about 10 years ago. It was about 10 years ago, in 2012, I started having tachycardia, and one day I thought I was having a heart attack. I rushed to the hospital and I went through the examinations, EKG and everything, and they decided that there was nothing wrong with my heart, that I should undergo my normal life, being careful on my diet, less caffeine, less alcohol, regular sleep, that sort of suggestions, medical advices that they gave me, and I continued having a normal life again. But these tachycardiac attacks became more and more frequent in time, and by 2018 I was having them almost monthly, sometimes bi-weekly, sometimes a few times a week, and I was trying to isolate the reason behind it, and I realized that every time I had flatulence in my stomach, I had the extremely high heart rate, tachycardia. And every time I went through a cardiac examination, they found nothing. They did all sorts of tests, echocardiography, BT scan, CT scan, and exercise stress tests. None of them yielded to anything significant about the condition. So time went by. It was about, I actually had to go through this for about 10 years. None of the cardiologic examinations resulted in anything significant pertaining to tachycardia. They just could not explain it. They looked at the scans, they looked at the angiographies, they looked at inside my heart a number of times. They just could not find anything because there was nothing wrong with my heart. And finally, earlier this year, I went through another cardiological examination, and they put a Holter monitor on me. They watched the heartbeats for 24 hours, and this time they came up with a new concept, a new thing that they observed, which is called ventricular extrasystoles, which are like heart hiccups. And they said that I had like 5,000 of those in a day, so this is rather unusual. So I should see an arhythmia expert about it. Maybe they will apply catheter ablation in my heart. It was then I decided I should get a second opinion, and I decided to go and see Dr. Yüksel. And I came to see him in his office, and as soon as I started telling him about my symptoms, he told me that, well, it's obvious that your PECTUS excavatum is the reason behind all these symptoms. And he explained me how the whole PECTUS worked, how my heart was pressed against by the sterna in my ribs, and how flatulence makes it more congested inside the PECTUS, and therefore higher heart rates. So we decided to undergo the operation, and we set the operation date as early as possible, probably within 10 days of my first examination by him. I was undergoing the surgery, and which is not a simple procedure, but I was more concerned about the aftermath of the surgery. I thought I was going to have a lot of pain. It was going to be unbearable, but it was only a few hours after I went to my room in the hospital. The pain was almost gone. The first night was very comfortable. I was able to sleep well. And the second night, when they cut off the IV painkillers, it was a bit painful, but was only for the night. And it wasn't something that I could not bear. It was just uncomfortable. And starting with the third day, I started getting better every day. And I was able to walk on the third day. I was able to take a shower on the fourth day. I was able to dress myself up. I was able to tie my shoelaces. I was able to continue with my daily life on my own. Didn't have anybody, didn't need anybody to help me with my daily routine. Now, a week after the operation, as you can see, I can talk very comfortably. I can sit very comfortably. I can have a normal life, and I believe if I can do this at my age, at the age of 55, with such large bones, if you like, anybody with such deformity should not think twice about having the operation, and they should do it, because the sooner it gets identified and done, the easier it is to recover from it, and people should not have second thoughts about it. And it was a very successful operation. I would like to thank Dr. Yüksel about and his team for the excellent job that they performed. And I suggest, do not wait for anything. If you have a pectus deformity, go and have the operation as early as you can. Thank you.